Good evening, everybody. I think at this point we have a number of people in the chat. In fact, I think we have quite a few people in the chat, and you're all very welcome this evening. You saw probably at the beginning of this a outline of the speakers that will be talking to you this evening. And I'll talk to you a little bit more about those in a moment and tell you a little bit about how we're going to do the webinar this evening. But just some very quick housekeeping points from me as MC, and I'll tell you who I am as well in a moment. The event is being recorded, as you can see there. Not the Q&A, we will be asking for questions, and those questions can be brought to us in the chat bar throughout the evening, and people in the background who are helping to organize the event will be bringing those questions to us at the end. If you can, will you keep yourself on mute if possible? The reason for that is that once somebody starts speaking on their speakers, you get a lot of feedback if somebody else has their microphone on. So if you can do that, that would be very welcome. So those are just a few of the housekeeping things. We're going to have the opportunity to have a conversation over the course of the next hour. And we will have speakers who will talk for up to about 7 minutes each, and they'll talk to you about their own experiences, and I think you'll find that very interesting. My name's Gary O'Brien. I'm the MC for the evening. I'm the Vice President of Governance and Strategy in Mary Immaculate College, and I'm also Independent Chair of Paul Partnership in Limerick. And I hope all of you at this stage know that tonight's discussion is part of the 2020 Lifelong Learning Festival. The festival is in its 10th year now, and this year is focusing on the theme of celebrating and building learning communities in Limerick. Again, some of you might know, but maybe others not, that Limerick is a designated UNESCO learning city region. And it's a great credit to the organizers and the people involved over the years that this marks the 10th anniversary of the festival. Our panel this evening is going to talk to you about the impact that COVID-19 is having on diverse minority groups in Limerick City. And I know that it'll be a rich contribution to this year's theme. The panel members are better equipped than anybody I can think of, and are very well known to talk about Limerick as a city, the perceptions of place and belonging that people from diverse backgrounds have within it, and how the pandemic at the moment is affecting, shaping, transforming these perceptions in what is an unprecedented moment for all of us in our lives. So the guest speakers will speak first about their own experiences and what they've learned from their own circumstances, whether they're professionals and practitioners working in community development, both here in Limerick and in places that they've been along their journey to this place, and they'll tell you about that. Or people who found themselves living here and have a strong interest in community building and also in learning. You'll be hearing from people who are highly experienced in working with diverse communities and who themselves have been engaged in the continuum of education, from doctoral students to those seeking to bridge the gap from living within the direct provision environment to entering into higher education. And again, hearing about how COVID-19 has made the challenges that people face all the more difficult at the moment. But there are opportunities as well, and we'll hear about that. Before I move to the first speaker, I'd like to just offer my appreciation to the very hardworking, passionate and committed organisers of this event. Shanti Corcoran is one of them, and many of you will know Shanti. She's a lecturer and PhD candidate in Mary Immaculate College. She's looking at perceptions and attitudes towards equality, diversity and inclusion amongst post-primary pupils, and that'll be a really interesting and important piece of work. Del Foster is the other organizer, and along with Shanti, has put a huge amount of work into tonight's proceedings. Del's the program manager for Athena Swan at Mary Immaculate College, and that's a framework for action and higher education that seeks to advance equality, diversity, and inclusion in all aspects, from recruitment of staff to universities and colleges, to the quality of the learning experience that students enjoy, and ensuring that it's marked by diversity and inclusion. So that's the background and context for tonight. The most important people you want to hear from are our 6 speakers. The first person I'd like to introduce you to is Ahmed Hassan Mohammed. And Ahmed is well known, I think, across Limerick. He's the integration support worker at Doras Limni at the moment. He has over 10 years of experience working in areas related to human rights and youth and education, environment, peace building, gender, and leadership. Before Doras Limni, Ahmed was responsible for coordinating the refugee resettlement program under Doras, and for the last 3 years with Syrian and Iraqi families. He's also been Youth and Student Initiative Leader on under the Global Peace Foundation Ireland program, a youth-led wing that focuses on engaging youth and students within Limerick and Ireland in environmental sustainability, peace, and education-related projects. And learning and youth are themes that you're going to hear a lot about this evening. And as I say, the people who are going to talk to you have more experience in those areas than anybody I can think of. So I'm delighted to welcome, first of all, Ahmed Hassan Mohammed. Ahmed.
Thank you very much, Gary, and thank you for that introduction. And I hope I do you justice in terms of it was a very nice introduction to this evening. And I would like also to welcome whoever is on the other panel and the people who are joining us this evening. So, as Gary said, my name is Ahmed Hassan, and I have lived in Ireland for the last 15 years. And as a migrant myself, it's kind of a place that Limerick I call home also, because I've lived here also for 10 years in Limerick. So going back also to my position at work, at the moment I'm the integration officer working in Doras Limni. And Doras Limni is a human rights organization that supports migrants, and it's a non-profit organization working to promote and protect the rights of people from a migrant background. So our vision is to create a society in Ireland where equality and respect for human rights of migrants and have, in terms of integrate them in Ireland. So during, in terms of having this pandemic at the moment, it's kind of has changed the dynamics of our working, because we support mainly, we work with migrant asylum seeker, mainly in terms of advocating for them in terms of their rights, in terms of their immigration status in Ireland, and also in terms of their process in transitioning from DP centers into the mainstream society. So with the COVID situation, it has really changed the whole dynamic of working. So I'll start from the aspect of the asylum seekers who are in Ireland in terms of how it has affected them this COVID period. Because in terms of most of the asylum seekers that we work, they're all, at the moment when they're having their process, they're all in DP centers. And most of the time, in most of the DP centers, the numbers are a bit fast. So, and it takes some time for the whole process to take place. So usually some people might spend quite a period of time in the DP centers. And with the COVID situation, some of them had to be moved around to reduce the numbers in the centers. So that took a toll with a lot of our clients, because some of them had been living in Limerick for quite a number of years and had established connections. Some of them were working in the community. Some of them had friends, and they were expecting once they get regularized in the state that they would stay in Limerick rather than move somewhere else. So when COVID happened, they had to be moved in different places, in different counties. So that was also, it took a toll with a lot of our clients, even though we kept in touch with them, but it wasn't easy for them again to readjust from living in a place where they call home, also in Limerick. And also it took a toll on some of our clients who were healthcare workers living in the DP center. Even though they were accommodated, they were given a chance to kind of request for a place outside because they were working in the community. but it still was a problem in the beginning because they were going back to the DP center, and that wasn't an ideal when there is a pandemic going on. So it's not easy to social distance when you're living in a DP center. So it was a scenario whereby we were trying in terms of taking the government instruction and HSC and kind of liaising with our clients. So with that, it kind of created also difficulty, and some of them, some of our clients, the connection that they had, it created a little bit of a disconnect because they couldn't associate with some of their friends who were moved and all that. So it created a sense of that they don't belong. And that was also a big issue in terms of navigating and making some of our clients understand that. Another group that we also support are generally the migrants. And that's also a big contingent of people that are living in Limerick. So when COVID happened, some of them, most of the migrants that we work, some of them lost their jobs, and due to the situation that happened, and there was a domino effect with them losing their jobs. So you can imagine somebody, they're supporting other people, extended family back home, their own well-being, being in Ireland, having that kind of freedom of doing whatever they want. But once they lost their job, then they had to worry about their mortgages, their rent, being in a rent arrears, and all that had kind of another effect for them, because even though they could access the state support in terms of all their, while they were working, they were able to get the money, but it wasn't sufficient enough because they had other extended family that they were supporting. Another group that we also support that we knew they existed are the undocumented migrants who have been living in the state for quite a few years, and they haven't come into the state, don't know that they exist in terms of the state until COVID happened, because most of them were working underhand, they're receiving cash in hand, they were able to kind of pay for different things, but when COVID happened, they were not able to kind of have the jobs, so they couldn't access some of the things, and some of them, the biggest kind of surprise, it is in Ireland, there's 17,000 undocumented people. So you can imagine that's quite a big number in the whole country. And you can imagine most of them were afraid because to seek help, even though there was Limerick Food Partnership that was done in Limerick in terms of to kind of assist some of the clients. And it was anonymous. So people didn't have to leave their details and all that. Even though the Department of Justice assured that there will be no data sharing between government departments with regard to undocumented migrants. So still, it has to be kind of a relationship for us to kind of liaise with them and say, you know, you can access some of these things without you exposing yourself. And that is the biggest kind of worry with most of them. And it is something that at the moment still, that it is a problem whereby some of these people don't know if they'll get back to work, because it's kind of an issue that is rotating, and most of them have been in the state for a long period of time. And we kind of try to advise in terms of regularizing their status in the state that they have been here for a while. And also, as you know, in Ireland, to access in terms of medical and all that, you need to have a PPS card. And most of the undocumented migrants didn't have that, even though they were able to kind of get some of the services eventually before, but most of them were worried. So we had to do a lot of give and take, and also information out there to kind of say you are able to access such services. And also during the period of COVID, there was also an aspect of international students who, some of them were in a limbo in terms of do they stay, do they go, and the time frame of when, even though they were kind of getting all the information from their respective colleges and universities, but they were still worried in terms of the international dynamics of moving from one border to the other. So we did kind of sometimes liaise with the international students and giving them advice in terms of if they want to move. And there was a bit of worries in terms of if I go, when will I be back? and all that, even though they were getting all the information from the colleges. So the impact of COVID has kind of on the migrants group and all the clients that we are working with have been affected immensely, and it has changed the whole dynamic of the way we work ourselves. Because it was easier in terms of, because we have face-to-face encounter, and we could explain, we could liaise with the client and give them advice. But now that we were working for the duration of the COVID, we were working remotely, and it was very hard, and working through WhatsApp messages, email, and all that. But it wasn't the same in terms of facilitating and in terms of also managing the expectations and needs. So it is kind of a new way of working, but at least we're managing in terms of changing the areas in terms of advocating and also making sure that they get, but out of this also there was good side of it, because there was the social justice movement that came out of this, that in terms of all the other issues that were happening around the world with the Black Lives Matters and all that, it kind of changed also in terms of how we advocate ourselves. And also for an organization like us as a migrant, in terms of changing the legislation in Ireland, in terms of the issue of hate crime and all that. So it is kind of a new dimension and the discourse of what is happening at the moment. And it is welcome within our group in terms of changing the legislation and finding new ways to work through this COVID era.
Ahmed, thank you very much. I think you've given us, in such a few minutes, you've given us such a rich sense of the work that you've been doing and that Doris has been doing. You've given us a lot to think about as well, and to come back to when we're talking at the end. 17,000 undocumented people, unprecedented challenges economically and in terms of just integrating into the fabric of society in this COVID era, where people are fearful of making themselves known for and presenting themselves for services. That's a extreme anxiety added to the kind of the normal anxieties that people are facing in relation to a public health crisis. I think you've given us a great sense of how essential a service like Doris is there to build trust with people so that they can avail of services. So I want to thank you very much, and I want you to stay on standby to come back to some of these things, because I'm sure people will have questions about them at the end, and we can expand on them at that time. So thank you, Ahmed. And the next person to come and speak to us this evening is another person who I think is increasingly well known in the community development sector in Limerick. Anne Piercy is a personal support worker with GOSH, previously the Red Ribbon Project. Anne joined GOSH in 2014 as a volunteer, and like so many people who volunteer in community development, you're eventually sucked into working in the area, and became a staff member in March 2018. Her work primarily involves working with people living with HIV, including people who have HIV or people who are affected by it in some way, including family members and friends. Anna's worked with communities all around Limerick, Clare and North Tipperary, including migrants and asylum seekers. And before arriving on these shores, Anne worked for the UNHCR in Malawi. She was a protection officer there, determining refugee status, coordinating voluntary repatriation and resettlement programs as part of a program for refugees from the Horn of Africa. At the moment, she's currently pursuing a master's in public health with the University of Limerick. So I think you'll agree, Anne is somebody who has unique insights and a huge amount of experience in forming those insights. So I'm looking forward to what Anne has to say. Anne, over to you.
Thank you, Gary. Thanks for that, and thanks, Ahmed. Today, my name is Anne, and I think Gary has spoken clearly about what my role in GOSH is. Just to be clear, GOSH stands for Gender Orientation, Sexual Health, and HIV. So I'm the person who kind of like minds the HIV section. It is with a sad note today I'm starting my presentation, and all because if some of you are aware, Timothy Ray Brown, also known as the Berlin patient, died this morning. And Timothy was an ambassador of hope for so many. He made history by being the first person to be cured of HIV through a bone marrow transplant. His legacy lives on as doctors and scientists continue looking for a cure for HIV. So I'd like us to maybe just spend about 5 seconds in, we should observe a 5 seconds moment just for Timothy for now. Thanks. Moving on to HIV and COVID. During the lockdown, there's been a lot of challenges. One of the challenges was the hospital appointments. Hospital appointments for people that are living in the rural or the outskirts, transportation was a big problem for so many, especially people that are in direct provisions, and the direct provisions are out of town, because they definitely do rely on public transport. So there was no public transport in the lockdown, and there was a lot of anxiety to how am I going to get my medication? When am I going to get my medication? There was no any other alternative for people to get their supply of medication, which brought them to be very anxious and making phone calls all the time to how do I do this and how do I get my medication. But the clinic was open, the STI clinic in the region was open. It was only open for appointments. So if a person didn't have an appointment, then they wouldn't be able to access the services. And also because of the restrictions, people that were living in direct provision, for them to go and get medication, they needed to get a letter from the management. And a lot of people that are living with HIV at the moment, they have not disclosed their status, or it's up to them to disclose their status or not. So people that are living in direct provision, most of them wouldn't have disclosed their status to maybe the management. And this caused an anxiety amongst people that are living with HIV to how do they actually get a letter from their management to say they want to go to the hospital to go and access medication. Now, that's the point of exit one. And then the second one would be that if suppose they manage to exit the direct provision and they're on their way to the hospital and they meet the guards, what do they say to the guards? How do they explain themselves where they're going to? They're going to the hospital, yes, but then do they need to tell the guards that they're going to the hospital because they're going to access treatment or therapy for them living with HIV? It was a challenge, a big challenge, but what the hospital was doing was anybody who is recorded with them or who visited their hospital, they would have appointments made already for them. And if somebody didn't have an appointment, then most of the times they would call me and I would call the hospital and try and make arrangements for appointments. Another issue that was coming about was it was due to the infection numbers of HIV went up. I'm saying that the infection numbers went up, and it's not that there was a lot of activities going on during this time. Not really, but it's because people that have been living in the country, as Ahmed said, we would have undocumented migrants, or we would have people that are coming here to work and then they go home every maybe 3 months. So when they came here, they would be stuck and not be able to go back home to go and access their medication. Thus, we started getting phone calls about how do I access medication? I'm running out of medication, or maybe I only got 1 week's supply of medication. So our offices, myself, I had to phone the regional hospital and link them in to in order for them to get their medication. At the same time, it's not when they are linked in, they just don't go straight away and start assessing the medication. No, the hospital here has to do all the tests that are required, because it's like they're opening a file all over again. And you can imagine that a person has to now wait again for about 2 weeks before the results come back. And the results are not trying to prove that the person is living with HIV. It's just for the hospital to know where the person is, if their viral load is suppressed, or if their immune system, how many CD4 count the person has got. Another challenge that we experienced was a lot of self-diagnosis. Of course, Dr. Google plays a big role in people's lives nowadays. Anybody who wants to know about information or get information, they'll go on Google and Google HIV symptoms, and they'll find the HIV symptoms. Let's not forget that the HIV symptoms are the same like our daily lives. A person who has HIV or who's living with HIV can have flu, can have a cough, can have a cold, can have swollen glands, just like normal, just like everybody else has. So a lot of people were going on the Google and Googling, and the moment they see that what they're feeling is what Dr. Google is saying, then they would be phoning in a panic and saying, well, I think I have HIV and I need to go to the hospital, I need to go to the clinic, or I need to do a test with you, which most of the times is not the case. It's just that it's a normal flu, just like everybody else has. GOSH offers testing services, and the services that we have, we do a rapid testing, and it's HIV, syphilis, and hepatitis C. We do 3 tests. These tests, they take about 60 seconds for you to know your results. And it takes about 20 minutes approximately for the whole process to happen. So if a person feels that they've been at risk of HIV, they can always give us a call, book an appointment, and come in, and we do the test. The test is mainly a prick on the finger. We draw a small little blood, like a dot of blood, and we do the test and get the results. You will be amazed of how relieved a person is after doing a test, because let's not forget that in order for an HIV virus in the body to attack the system and for the system to collapse completely, it takes about 10 to 15 years. So a lot of people would be walking around living with HIV and not knowing. And this time, because HIV is a virus, coronavirus is a virus, so people were very frightened, people were very anxious, people were very stressed, because the symptoms actually are more or less the same. What I wanted to say today, I've got a lot to say. I think I would take the whole day if I was to start talking about HIV. But just to mention something as well is U equals U. At the moment, right now, a person who's living with HIV and is on effective treatment, they cannot transmit the virus sexually. And also, they live a longer life, just like everybody else. And just this statement alone, I think it's helping in actually, when it comes to discrimination and stigma. So message that you can carry today is a person living with HIV and is on effective treatment, they cannot transmit the virus. And the only way for a person to know that they're living with HIV is by testing. So please, our doors are open. If anyone feels that they've been at risk, maybe not today, maybe not yesterday, last week, the past 3 months, the past maybe 5 months, 2 years, 10 years, it's time to start thinking of testing. Thank you very much. Thanks, Gary. Over to you.
Thank you so much, Anne. And you've really packed so much into just a few minutes there. I think we're really fortunate to have you here and to give us all of that information. It's very useful, and hopefully for people who are listening in and anybody they know of who may have concerns. It's a time of great anxiety. That's been the theme that's common to what Anne and Ahmed have just said, but they've also pointed out that for people who are anxious, and this anxiety at this time is affecting people in our migrant communities more than anybody else. The existence of services like GOSH and like Doras Limley are absolutely vital. So please support those services and please tell people about them so that they can avail of the kind of support that you get from people like Anne. And thanks so much. Again, you have so much more to say, and hopefully we get an opportunity at the end to come back to some of those things. So thank you very much.
One last thing. Yeah, one last thing. The treatment is free, so there's no payment for the treatment, and even the test is free. Thank you.
Thanks, Anne. So just a quick reminder to anybody who's joined us in the last little while after the start of the session. We are recording the session, but no questions that are asked will be recorded, and nobody's face or anything like that. It's really only recording the speaker. So that's just a quick housekeeping rule there to let everybody who might not be aware of that know. We have a young woman called Mamobo Ogoro to join us next. I'm really looking forward to what Mamobo has to say. We're lucky to have her because she is the first Sanctuary PhD fellow from the University of Limerick, and the University of Limerick became a Sanctuary University a number of years ago. And the Sanctuary model of universities designed specifically for people who are new migrants into countries and to give them the opportunity to bridge into higher education. So Mamobo is the first Sanctuary PhD fellow, and she had already come with a background in social psychology. And in her work now, she's applying her knowledge into the multidisciplinary field of applied linguistics and social psychology. Really interesting stuff. Research that focuses on multicultural, bicultural identities and linguistics, and portrayals of othering in Irish society. And this has been something that is hugely relevant to what we're talking about as a society in Ireland at the moment. Many people have been talking about this, and we've reached a point in this country where you can be Irish and you can be Black, you can be Irish and you can be African, you can be Irish and other things as well. This is what Mamobo is going to talk to us about, and her personal experience as an Afro-Irish person growing up in Ireland, and how she regards and manages her dual cultural identity. So Mamobo, over to you to talk to us about your experiences and the work that you're doing. Thank you.
Thanks, Gary, and thank you to everyone that is attending this meeting today, and thank you to the people who organised this meeting today. So I'm just going to touch on two things, the direct and the indirect impact of COVID on diversity. So as Gary mentioned, my name is Mamobo. I am Sanctuary PhD Fellow here in the University of Limerick. And a part of that is I'm doing PhD, of course, and a part of that as well is I'm the administrator for the Sanctuary program in the university. As Gary stated, it's a program that facilitates the access to education for people who are in refugee-like situations. So generally our students are asylum seekers or people who have refugee status as well. So some of the impacts that COVID has had on these individuals, some of the physical impacts that it has had, was that the university, just physically going to the university used to be a space that our students used to be like separate from the circumstances that they were in. They were just a student, and that was the identity that they held for the day, for the week, while they were on campus. So taking that away from them has kind of put them back in a space of just like back in their center, the direct provision centers, most of them, and just taking that away from them has kind of impacted them in a way that they're going back into and drawing away from their education in some sorts. This has a lot of mental effects on the students, as they're now in their centers, which is a lot of times a lot of people, lack of privacy, lack of space. So focusing on education and doing that at the same time is very, very difficult. Another physical difficulty that these students may have would be access to internet, access to internet facilities, access to phones, access to laptops, because some of the things that we don't think of ourselves is we just have laptop, we just have internet. But these are some difficulties that some students may have, and which definitely impact their mental health. So those are some of the direct impact that COVID has had on our students. And I'm going to touch on just a bit on the indirect impact that COVID has had on a society as a whole, and it draws on my own research as well. So what I've noticed, as everyone has probably seen over the past couple of months, so given that everyone is inside the house due to COVID, everyone has had a lot of time to think of sort of like the social elements that are happening in society today. We have seen this with the whole Black Lives Matter movement, and with all of these things that are happening around the world with the protests and everything. So one of the indirect impacts that COVID has had in terms of diversity in Limerick and in Ireland as a whole is people are now questioning and people are now speaking about what it means to be Irish, what it means to be Irish in 2020 Ireland. So you would think 30, let's say 20 years ago, it was a totally different thing, what it meant to be Irish, what it meant to look Irish 20 years ago. But now people are having the conversation of what it means to be Irish, and that touches on my research as well. So what I'm looking in my research is that I am looking at othering and the social representations of first and second generation immigrants in Ireland. I am the daughter of a migrant, let's say. I moved to Ireland when I was 3 years old. When I was 3 years old, yeah, we moved to Ireland. So I'm looking at the relationships between othering and social representation in second generation migrants in Ireland. So what I'm finding now is that a lot of second generation, this is like the children of migrants, they're either born here, they've grown up here their entire lives, they identify as Irish, they see themselves as Irish, but there's sort of like a disconnect between them. These people you can describe as bicultural or multicultural. So what I'm finding is that a lot of these people, they have these they feel like they're neither here or there. They feel like they're in the middle, myself included. So it's like you feel connected to the Irish culture, but because of different caveats that you may identify with, and because of your ethnic background, you may not feel as in touch with that as your ethnically Irish peers. So that's an issue that needs to be raised, because a lot of researchers that focus on migrant experiences tends to forget the children of the migrants. What are the outcomes of migrants or immigrants in Ireland? So that's one thing that definitely needs to be researched and looked upon in research as well as the caveats of belonging in Ireland, what it means to belong in Irish society, what it means to see yourself in Irish society, what it means to see yourself in the media, in sort of public spheres, when you don't necessarily quote unquote look Irish. So that's one of the indirect impacts that I feel that needs to be touched on more, needs to be researched more. We need to see the experiences more of people of different ethnic backgrounds who do identify as Irish themselves, and we need to see that in different caveats, in whether it is education, whether it is media, whether it's television. That needs to be done. So that's the bit of piece I have here. Thanks.
Thanks so much, Mamo. I'm really looking forward to reading more about your work, and I presume it's going to get great publication around the place, because it's coming at a time when it's sorely needed, but it's a huge contribution to make, I think, at this time in Irish society. it's going to be really, really interesting. I think there are lots of challenges, like you say, and particularly for people who do feel in the middle of identities. But I think there's a great challenge, there's a great opportunity as well to produce new identities and new understandings of what identity and culture means. And I think in Ireland, we've been waiting for that moment for a long, long time. So I think your work is really going to advance us in that way. So thanks very much. And again, please stay on at the end. And I'm sure people will want to come in and ask you maybe more about your experiences or about your academic work, or indeed about the University of Sanctuary program that you're involved with. So thanks very much.
Thank you.
So, accidentally muted myself there for a moment. So unmuting myself very quickly to introduce our next speaker. Another speaker from GOSH, again, to remind you, as and the gender orientation, sexual health, HIV, and that's the former Rainbow Support Services and also the Red Ribbon Project. And it's gone from being quite a small voluntary-led project over the years. It is now a comprehensive and a highly professionally run organization, and with people working there who are experts in their field. And Patrick McGilligan, our next speaker, is the LGBT project support worker. Patrick has a huge amount of experience working in the area of gender orientation going back 8 years, especially for those who are LGBTI+ and their families. So it's a comprehensive set of services and skill sets that Patrick has. He has additional qualifications in personal development and counselling skills, group consultation and evaluation. The list goes on. You've seen it in the poster. At the moment, he is another who is pursuing his own learning program, and life is all about learning continuously. And Patrick is currently studying for a master's in Gestalt psychotherapy. So apart from being a busy person by day, he's keeping busy with the books in his personal time. So to hear a little bit more about the work that he's doing and his own perspectives on where we are at the moment, Patrick McGilligan. Patrick, over to you.
Thanks, Gary. Thank you very much for that introduction. Just also to thank the speakers and the organisers for the opportunity to speak. I notice as I'm hearing other people talk, I'm heartened by the opportunity to share this space with people who make such a difference in the world of Limerick, because I think sometimes we think broadly, and actually the community is quite protected and safe as well within Limerick. So I'm going to talk a little bit about gender and orientation. I know Anne would have covered the HIV and sexual health aspect of GOSH. The organisation itself has been around for 30 years in different kind of guises, and it's brought us to where we are today. I think when I'm talking about the impact of COVID and how it has affected the people that I work with, I think it's really important to set the baseline around that. And in order to do that, I'm just going to give a little bit of information. So according to different statistics, 10% of the population would identify somewhere on the LGBTI spectrum. So they'd identify as LGBTI. That would be lesbian, gay, bisexual, transgender, or intersex. Within that, if we look at it in a Limerick perspective, 10% of the Limerick population is 19,489 as of 2016. So that would say that we have over 19,000 LGBTI people around us in Limerick, both in the county and the city. I think with the community before COVID, there would be quite high levels of severe or extreme stress or anxiety, and it's something that we in GOSH are constantly working towards. We offer counselling and support to anybody that needs it that would fall under our kind of identified areas, which are gender orientation, sexual health, and HIV, which really is everybody. And we offer support for them, their family members and professionals, as well as training for people. Within COVID and the experience of people, the process of coming to terms and understanding our own gender and orientation can take some time for people. If we look at times, say back in the 90s, the average age that we become aware of our sexuality is 12 years of age because we hit puberty, and that's when we start having desires. in the 90s, the average age for someone to come out would have been 23 or 24. So that would have been 11 years holding that secret. When we come forward to nowadays, the number is a little bit shorter. And in a lot of rural or urban areas, they would probably be holding that secret for 2 to 3 years. I suppose I'm naming that because of the importance of the experience on COVID and how it feels and how it is for individuals. Holding any information, no matter who you are, for 2 to 3 years can be a difficult experience. And I think especially in the circumstances of COVID, where a person's resilience is tested, their ability to reach out and get support is limited, and the way that they engage with the people around them sometimes can be a bit filtered. For us during COVID-19, it would have been a difficult experience as an organisation. We would have provided support remotely for as many people as possible. And also we had people who couldn't access that support, which was difficult. The reason behind that is it is still difficult for some people to come out, and often that is an experience that's personal to themselves. And I notice as I'm hearing other people talking, and we work with a lot of people who are migrants and who are in situations where they've come to our country to seek safety because their life would be at risk in the country they came from. And I think sometimes that takes a bit of time to adjust to, and often in the direct provision centres, it may not be the safest place for an individual to express their gender or their orientation, because it might lead to isolation, and it is something that we offer support around, and we do try to encourage people to access that as well. At the moment in Ireland, there is a few other kind of stark statistics that would say that 75% of people who are LGBT have experienced verbal abuse in their lifetime. And I think that is something that we're constantly challenging and questioning, not only as an organisation, but I think as a community and a country. I think Irish people are starting to look inward and examine themselves and make decisions about themselves in order to help make the environment a bit better. One of the main pieces of work we would do is we'd ask people to consider their own gender, consider their own orientation and how they identify, and see how it might feel for them to express that. I think in Limerick we're unique in some ways. We have a caring environment and we have one that respects individuals. And I think like most urban areas, there are pockets of acceptance and there's pockets of prejudice. And I suppose we would also encourage people to look at themselves and identify how they can explore that in a different way. To turn the focus a little bit more towards the experience around COVID and how that has been for people, I would work directly with people in a one-to-one setting through support, and I'd have the information from my colleagues who also provide support to individuals and families. And what we've seen is that the isolation is amplified. I know I heard someone talk earlier about the silence, and it's like with the isolation, there's an echo in the silence for people. That sometimes the ability to reach out and to have a chat with someone that they might have been able to have a chat with is taken away because they don't have that physical connection. As well as that, if they are isolating or if they are in quarantine with their family and their family don't know about their gender and orientation, that can cause a bit of confusion. They may not be able to take phone calls because then people would hear it and it might compromise their safety. And for us, every single person's safety is our absolute paramount consideration. If a person is not safe, we do not encourage them to make themselves unsafe. Some of the things that we would like to see improved is stuff around heteronormativity. So when we meet people, that we don't assume that if we meet a man that they are a man and that they are automatically married to a woman. We'd ask people to expand their consciousness and open up to the idea that people are people, and sometimes their lives don't look the same as our own, and sometimes they do. I think it's really important to name that as well. It's good to find people that are like us. There's also the piece around education. We think it's important to name that people will work with people who are LGBTI. Most people will have met someone, and most people will know of people and their struggles and their champions, because there is a lot of resilience. I think anybody, and I've heard it from other speakers, if you've been through any hardship, much like everybody has, you do build resilience and you are able to look after yourself and lean on things that offer support to you in certain environments. And we would always encourage that as well. I think as well with it, there is some freedom. I think something about COVID, and we'd spoken about it with a few clients, that actually the fact that they were quarantining and they were in their own their space. And I know Momobo mentioned it, that it was time to think for people. And actually I think something about COVID that was really positive was that people got to think and they got to feel and they got to understand themselves as people. and find out where they are and how they identify. And I think that is one of the biggest strengths of COVID and what it has done for people. As I come to an end, I suppose it's just as Anne had mentioned earlier on, we are on Davis Street, we are in the middle of the city, and to anybody that would like some information or to drop in, we are always available. We're on the end of the phone, the internet, an email, a text message, in person, and we have a few doors on the way in, so confidentiality is always paramount for us. Thank you.
Patrick, thank you so much. Again, huge amount of information and insight as well in a short amount of time. So again, looking forward to coming back maybe to some of those things. But some of the things that you said really struck me as important, that we are, as people in a society today, looking inward more, and that's a healthy thing. But you also said that it's important to take the broader perspective as well and take a wider field of view. And that's something I think that it makes the services of GOSH extremely important. And I suppose the advocacy role that GOSH has and the role that it has in raising awareness of gender, orientation and sexuality issues reminds me of somebody earlier today in a meeting I was in saying, why do we talk about equality, diversity and inclusion? And they were genuinely asking that question, why that and not other things? And somebody spoke up and said, well, you know, it's because in terms of equality, diversity and inclusion, there's a long road still to travel. And I think that's true. And I think what you've heard from Patrick there reveals that we still do have a long way to go in relation to the issues that he spoke about as a society. But the presence of services like GOSH are clearly essential. And thanks, Patrick, for sharing your experience with us this evening. So the next two speakers are going to do a bit of a two-hander, a double-hander between them. The next speaker is Shay Maloney from Limerick Youth Service. And Shay is a youth worker whose work involves supporting migrant youth through the provision of weekly dedicated youth space where young people can discuss their issues and challenges while also participating in various personal development programs. So it's a very important space, it's very important work, and it, I think, reveals stories that you're going to hear a little bit more about later on, which I think you'll find really interesting and really, in practical terms, revealing of the lived realities of people's lives in Limerick at the moment. So I want to pass over to Shay, first of all, who's going to talk a little bit about the programme in Limerick Youth Service. Shay, over to you.
Thank you, Gary. Hello.
We're good to go, Shay. Can hear you.
Yeah, can you hear me?
Yep, perfectly.
Okay, good afternoon or good evening, everybody. As Gary said, my name is Shay Maloney. I'm a youth worker with Limerick Youth Service. Limerick Youth Service delivers youth work and education, training, employability programs, and volunteering opportunities for young people. Examples would be, for example, counselling through our Be Well team, Garda Youth Diversion projects, international youth work, and youth CAFs, etc. Our mission statement is connecting with young people and supporting them to reach their full potential. Very, very quickly, I would like to give some context to my role. I work with young people from the ages of 10 to 18 in rural and urban settings in Limerick. Part of my work is specifically engaging with young people in direct provision and their families, as well as young adults. And also those that were formerly in DP. This group, I think, requires ongoing support as they move from a highly institutionalized setting. I would like to talk about the specific impact of COVID-19 on the population, and it will focus in the areas of education, social interaction, and physical space. You may be aware of direct provision centres accommodates people who arrive in Ireland and are seeking international protection. Only 3 of the 39 DP centres are purpose-built. The majority of centres are located outside of main towns and cities, and as a consequence, residents feel excluded and isolated from mainstream society. Families living in these centres have little privacy and space, and in my opinion, does not foster a natural family environment for children to develop and grow. Also, there are issues with safeguarding children because of unknown single adults living in the centres. Children feel more included while in school, and from an education perspective, I believe children were impacted significantly more than their counterparts in accessing their educational needs online due to many factors. They include lack of access to technology, including laptops and iPads, and dealing with intermittent Wi-Fi connections. Study space and lack of extracurriculum activities were also problematic. Like some young people, in my experience, had difficulties maintaining Wi-Fi connections. For example, some young people had to go to the main reception to connect their phones in order to get the internet. Doing homework was very difficult because of a very busy small living space, and was a challenge for both young people and parents. Structure and routine within the family unit was also difficult to maintain, and also then the lack of physical activities that young people would normally do in school ceased. Also, some migrant families have a significant emphasis on education attainment for their children, and as a means to a direct quality of life. And I think that also further highlighted the pressure on young people. Just moving on then to the physical space in DP, I think because of the limited physical space in direct provision, there has been emerging tensions within the DP community according to some residents. Young people and families living in DP are categorized as high risk of contracting COVID-19. Their living environment is not suitable for maintaining COVID-19 guidelines. There is no space, I think, for families to be placed in by themselves, and residents have to share facilities, for example, dining area and laundry, which can lead to heightened tensions among residents. Also, residents who are working outside and returning to the main centres are a cause of anxiety and fear for other residents within the DP centre. For example, one young adult found the lockdown very challenging. Her fear of catching COVID-19 and lack of control over her health led to her self-isolating and increased anxiety. Also, some of the residents were concerned about the stigma associated with having COVID-19, and as far as I understand, it was a real fear for residents, as they felt they may be ostracized within their community if they end up getting COVID-19. And then some other residents had concerns about those that might have underlying health conditions had no way really protecting themselves because they had no control because of living in a DP centre. So just moving on then to the kind of social interaction and the youth provision that we engage with young people. So as I've mentioned already, I think living in DP is people are more isolated and excluded in our society. Even before COVID, transport and financial restrictions were used barriers for residents to be able to engage with the local community and wider society. With COVID restrictions, young people cannot access our dedicated youth space, which Gary mentioned in the introduction, which provides a space for young people to be themselves and not to be judged. Our space also allows young people to discuss issues that affect them while also maintaining strong relationships with their friends and peers as well as adults. I think as a consequence of COVID-19, young people could not engage in civic and community events, such as the Youth Factor, youth games, marching in St. Patrick's Day Parade. Participation in those activities give young people a sense of belonging and connection, which are very, very important to those young people. And in absence of not participating in those events, for example, have been felt by young people. Also, families who have moved to rural areas felt very cut off from their friends, especially young people who would have developed strong bonds with their peers when living in direct provision. So, maintaining, and also then a challenge for us was maintaining online connection with young people was difficult at times. I suppose I'm very aware that these issues facing young people in direct provision are also experienced by other groups. But I feel that those in DP face a particularly difficult clustering of issues. And I know that there has been improvements in the waiting times and living conditions for residents, and that residents can access the labour market. But that does not take away from the unique circumstances experienced by children living in direct provision. Like, children really want to kind of be accepted and really want to feel they belong within their communities. And just to finish, it was an interesting fact, according to HICWA report, 14% of children in DP were referred in a single year to TUSLA, compared to 1.6% in the general population. So that's where I'm coming from. So thank you.
Shay, thank you very much indeed for all of that. Again, a huge amount of information there about services of Limerick Youth Service, the work that you do with young people, and particularly about the problems associated with direct provision, but also some of the opportunities that can be created and are badly needed for young people in particular who are resident in the direct provision environment. I doubt if there's a single person joining us this evening or amongst our panelists who wouldn't say that direct provision at the moment is one of the most urgently, the most urgent issues that require our attention collectively as a society in this country. I think it can often be very difficult sometimes to imagine what life is like for people living in direct provision. But one of the great contributions, I think, of this webinar is that we're now going to hear from a young man, Tyrone Gillen, who has grown up in direct provision and has all of the experiences that Shay has spoken about there. And who has begun that long road into finding ways in which his potential can be reached. Tyrone, at this moment in time, has begun the long road to higher education, and the challenges that he has faced, again, in the COVID-19 environment, as well as all of the other disadvantages that come with being in the community that he is in, have made it a very long road and unfamiliar to many of us. So I'm looking forward to Tyrone sharing a little bit of that with you. But to tell you a little bit more about him, one of the things that he's very active in is the DAY group, which is the Diversity and Youth group. A youth group that meets weekly from all different ethnic backgrounds, where a respectful, friendly and non-judgmental space exists. And that group scripted, produced and performed a play that was shown in the Bell Table, which is a theatre here in Limerick, where the members of the group told their stories of living in direct provision and of the challenges and barriers they face, and of dealing with racism. To have those stories communicated in those very practical, lived reality, lived experience ways is extremely important. So I'm delighted now to welcome Tyrone to tell us a little bit about his experience where he has got to and where he's going. So over to you, Tyrone.
Thank you very much, Greg. My name is Tyrone, and I work very closely with Shay in the Diversity and Youth group. And as a member of that group, you can see all of the different challenges faced with especially young people in terms of COVID-19 and the lockdown and the restrictions. Because when I just did my leaving cert there, and I'm now pursuing further education, but when I was coming down to the end of my leaving cert, obviously it was when the whole shutdown happened, and that impeded on many people's education as well. And like 6 years is an isolating year in itself, because the only time you can really do anything other than study and cram all this information in your head is in school. And since that shut down, you have no real way of flowing anything, because all of your information is now on a screen. Your friends are on a screen. Anything social you had to be doing was on a screen. I thankfully was lucky enough to be involved in a number of sports and different sort of activities where I could get my mind off things. But obviously many people, many other students that I've met and I've known obviously don't have that type of escape. And it's an escape of everything, because what I'm saying is, like, it's hard to stay motivated when you're locked inside or when you don't really know what you're doing. Because as a kid growing up, I've seen it from my younger sister, from other people that I work with within the day group, that it's hard to have motivated and have a structure in place in your life in order to know what you want to do or know what you're trying to do, you know? And that sort of way, it's been very tough, because you don't know everything, because nobody knows, you know? You're going and you're kind of just listening to whatever you hear and kind of like that, and you don't really know anything, and nobody really does. And that's the challenging part, especially. And the youth space I work in is we'd go in, we'd have some fun, we'd talk about our things, and we became friends, like really close friends. And obviously during the lockdown, it's still very hard to do that, because some of the people and some of my friends that I talked to during the workspace is in rural areas, which is obviously very hard for them to come in, because, you know, buses weren't working for a while and all that sort of stuff. So it was very hard to keep a set structure and a set system in place, which is very challenging as a young person. It's very, like, depressing to see, because thankfully I'm old enough to be able to have other things that I can do, or I can go out on my own, that sort of way. But obviously, because I'm older, the people who are younger than me, and even my younger siblings and all, you see they have very challenging time, because my sister is, like, with her school now, schools have recently opened back up, so now she's getting her school, but at the same time she's still very isolated from all of her friends, that sort of way. So it's extremely tough, and especially your mental health while you're growing up. During the summer, Shay and myself have participated in a photo challenge for the group, which kind of just allowed them something to do, which was also just to keep their minds off things and keep everything rolling a little bit, just kind of keep everything moving. But even at that, it was very challenging to get all the students in place, because the challenges of the leaving cert itself, like, some of the people in the group were also still studying for their leaving cert, so that was a bit of a weird one, because we still had to go move on with other things, and then that sort of way. So we were waiting for our grades, we were doing this and we were doing that, and then the photo challenge really helped to escape with that. And it's scary to see, because with no real end in sight, we don't really know where things are going. We don't really know where we're going as general. So, like, I'm thankful enough, because my college has opened up on Monday, that my course is half in and half out. But even at that, when you get older, it's still very tough, because I have a very practical course, whereas other people, their course is all online. So they still have no contact whatsoever, and that is the very challenging part, especially with, it's the contact and not knowing in that sort of way. But even in that sort of setting, whereas like the challenges you face, like growing up where I grew up and experiencing the things that I've experienced, the challenges with racism we had, obviously, thanks to Greg with the play we did, we managed to get our point across, and it was very well received by the other youths that was actually attended the event, which was an amazing thing to happen. They were all there, and you can see how it has changed their view, because there's a whole stigma about living in direct provision, or, you know, when you're in school, there's a stigma around everything that you do, you know? Oh, you're always on your phone, you're always doing this, you know, that sort of way. So there's always a stigma around everything you do in school, and it's hard to, it was very accomplishing to see the fact that by doing the play, you managed to change other people's perspective on who you are as a person and what you're trying to do, because it highlighted the same exact challenges that they're facing. And even now, you're in the same sort of boat as them. You're the same stress, same environment, you're still at home, you can't really go out as much, contact is limited, all that sort of stuff. So I'm glad that we were able to, and myself and Shay were able to kind of keep the group active a little bit, so we were still able to talk to them that sort of way. But it has been a very big challenge, and yeah, it's quite scary in that sort of way. So that's it for me. Thank you very much. Back to you, Gary.
Thanks very much, Tyrone. Again, you know, there's so much there to unpack. Recently, in my day job, we did something. We reported on a project that we did around providing leadership skills to people who are undergraduates in higher education. So typically very, very young people who already show leadership qualities and are able to come out the other side of their education showing that they have those qualities, and that their institutions and their educational colleges and their courses underline that and show that they have had that. And I think what you've heard there is the importance of young people like Tyrone showing leadership within his community and within his circle. It strikes me listening to it that there's an awful lot of weight on young shoulders there, but the shoulders are broad, and huge amount of important work is being done in those pockets of rich interaction between people. Bring that play to the bell table, for example, to form the relationships, for example, that enable that to happen. All of those are building blocks towards something. But being part of that journey is being part of a leadership experience. So I think that young people have a huge amount to contribute, and we need to start recognizing them as leaders in our community right now, and encouraging them and supporting them in that regard. You probably agree that even though we went slightly over time, people that we've heard from tonight have given you a huge amount of information in a relatively short period of time. They've managed to pack in so much about services that are available for people, but about the challenges that people in our community are facing at the moment, particularly during the COVID-19 pandemic. But those challenges won't go away when COVID eventually goes away, and hopefully it will. And we have to keep working together to ensure that all of our lives are made better and enriched by the kind of opportunities that we can create by working together and listening to each other and hearing each other. And on that note, I want to invite both Shanti and Idel, who are furiously working away in the background to collect some of the questions you might have, so that we can listen to you now and hear what you have to say. And in particular, if there's any questions you'd like to ask in relation to some of the things that our panelists have had to say, now is your time to do that. So I'm going to just hand over to Shanti and Adele for a moment to help us with that. If there are no questions, that's fine as well, but I'm sure somebody will think of something. So I'm going to just mute for a moment and let Shanti and Adele take over for a moment. That are of practical importance in terms of information sharing for the migrant community, but also spaces where cultures can be represented and expressed and identities expressed. So everything from radio to broadcasting, the stories of people who are from diverse backgrounds, the cultures and the music and the theatre and the literature of people from diverse backgrounds. All of that is something that I know that people are looking at the moment, and there are opportunities for providing those kind of spaces that we're looking at. So hopefully in other fora we'll be able to speak a little bit more about those in coming months. I saw Anne's face flashing up there a moment ago, so I'm just wondering, Anne, do you want to come in there on that subject as well?
Yeah, I just wanted to talk about the space. For people that are coming from outside, like migrants, it's very important for us to kind of like come together in a space and meet and talk and chat and do things. Some of the things that maybe people should start thinking of is meeting in places like parks, where it's an open space, whereby maybe once a month you have something like aerobics or Pilates or something like that. Just once a month for 1 hour, people come, people from all over, people from everywhere, they come and they meet and they do this thing for 1 hour only, social distancing, and then they go home. For somebody coming from outside, it's very difficult because like where we're coming from, say Africa, our families are very diverse, yes, and they're very, we embrace each other as a community. So we don't stand alone, we are a community. When we move to a place like Ireland, you kind of like find you're on your own, you're isolated. It has actually proven very, very difficult and a challenge for people, especially women who have moved here and they don't know anybody, they don't know anyone, or else they know someone who's from their own country, but for them to integrate in the society, it actually has proven very difficult. So there are things that people maybe have ideas of coming together and just saying, okay, maybe once a month, let's do this. Once a month, let's have a coffee morning or something like that, so that whatever we're talking here, we can eliminate some of the stress, the anxiety, the isolation and all. And it's true about the communications group, the migrants communications group. It's about giving to the Irish society, who have actually embraced all the migrant community in their own community. It's also to show them that, okay, this is what you've done for us, but we also want to do something for you. We also want to show you what we can do. We also want to share our skills, share our knowledge, share everything, because we're here. You've shared everything with us, but we also want to share things with you. Thanks, Gary.
Thanks, Anne. It's a fantastic idea, and something I think many of us would like to participate in. Very, very practical way of getting to know other people, but getting to learn new things and forging links between cultures and forging new identities amongst us is something that kind of activity between us would enable. And I think that's very much part of what people have spoken about this evening would like to see happen. Edel or Shanti, is there anything further that you would like to add, or is there any other question that somebody would like to ask? If not, conscious of people's time and everything, I might begin just to wrap it up.
I think so. I think people, and can I just say, people send some really positive messages, and I think that's important to say to the panelists as well. people talking about the leadership that some of the panelists have talked about, you know, in their own work, but also just to see this positive representation of Limerick. So we had some really wonderful feedback, which I think the panelists should be aware of. And I just want to thank those who participated for sending those messages. Thank you.
Thanks, Shanti. Thanks very much indeed. So I think it's up to me to try and wrap things up and bring proceedings to a finish now. So first thing I'd like to say in doing that is to, on everybody's behalf, offer a big word of thanks to our panelists tonight. The positive messages that we've got that Shanti mentioned there, I think, are reflective of just how much people were provoked by and challenged by what people had to say, and that's what we set out to achieve this evening. Just want to really, again, reiterate the thanks due to the event organizers. It's an important event and one that I think should be repeated in different fora and in a developing way. It's a conversation that must keep going. And the event organizers have contributed hugely there. And also our partners in Limerick Lifelong Learning Festival, as I said at the beginning, is the 10th anniversary of that festival. This year's theme is celebrating and building communities. And I think that tonight's discussion was an important and apt contribution to that. The last word for me is one of special thanks to all of you who took the time to attend and contribute. We were absolutely blown away by and delighted with the size of the interest that we drew. And as I think Adele or Shanti said, just before the event opened up, we had nearly 80 people signed up. So that's just wonderful, and just shows the interest and the passion that people have in this subject, and presumably how they want to contribute as well. You've helped push the equality, diversity and anti-racism agenda a little bit further towards the top of our shared priorities, and we need to keep pushing that. I've just realized that you can probably see some drawings on the wall behind me here, and it struck me that those drawings were done by my father. I recently re-inherited them from somebody who got them nearly 50 years ago and decided that they should go back to me as the artist's son. So I framed them and put them up on the wall, and you probably can't see the pictures, but the pictures are of iconic buildings and places and spaces indeed in Limerick City, which are reflective of the long history this place has, from a small dwelling of humans on the banks of the River Shannon to what it became in the 19th and 20th century, an important and internationally well-known city. Places like St. Mary's Cathedral, King John's Castle, and places like that. That's what are in those drawings, and you'll see them around the place. But they were drawn nearly 50 years ago. And I think today, within my lifetime, Limerick has changed utterly, radically, and so much for the better in terms of the richness of culture and identity and diversity that I think describes us now as a community in the city. So I hope that all of those changes, though they've thrown up so many challenges that we need to address, I think the changes have been, you'll agree, for the better, and that tonight's webinar and the contributions from the various people we've heard from shows just how rich the diversity is that characterizes the Limerick that we know today. And I think that's something to be celebrated. So thank you very much for tuning into us tonight and for listening so attentively and for asking questions. And we hope to see you again. Thank you and good evening.